So I think, obviously we're having this panel today because of a sharp rise in corporatization over the past 2 decades, however you define that. And the general valence is that that's been a negative thing. How do we pinpoint what's actually wrong with greater corporate activity in the healthcare sector?
So I think that, like everything in healthcare, it's complicated. And so there is no, as much as there's not a single boogeyman, there's also not a silver bullet. But what we see, of course, is the pinnacle examples of things like the financial collapse of Steward and Prospect hospital systems, and then the closures of certain hospitals, the patient harms that come from the kind of real estate asset stripping strategies. But in the physician practice context, we don't see the same sort of quality cliffs that we see when private equity buys physician practices, but we do see a change to the workforce. What is it like to work for a practice that has been acquired by a private equity company that is trying to, in a very short period of time, ramp up revenue and then sell and exit to another buyer? And I think that that's where we see some of these. Again, maybe it's not that private equity is altogether different in kind than other types and other historic forms of corporatization. It creates this moral hazard. The investors are using, borrowed money and loading the physician practices or the other targets with this debt, and they make money whether or not the thing that they leave behind is sustainable, whether the workforce is happy, whether or not that it's going to provide good patient care. So I think that that's where, maybe it's like the figuring out what are the most egregious harms or the worst risks are, to think about that, and maybe also to think about what is it doing to the profession that we see investors coming in, and this could be a good thing, right? A needed source of capital, a needed source of expertise. All of this information technology is very expensive, but the administrative burden of operating in such a system, of being a clinician, a rank and file clinician, seeing patients in a practice that is increasingly run by a corporate management service organization, can be